Hello, I'm Dr. Jim Del Rosso, one of the proud editors of Skin, the Journal of Cutaneous Medicine. And it's a pleasure to discuss with you today a paper that actually is the 2021 UCB Resident Research Competition winner, came in first place. And it's entitled Association Between Rosacea, Environmental Factors, and Facial Cutaneous Dysbiosis, a pilot study from the largest national festival of twins. And this is a festival that occurs yearly in Twinsburg, Ohio. And this is from August of 2017. The lead author is Dr. Justin Marson, and the senior author is Dr. Hilary Baldwin, who's well known in the areas of rosacea and acne. And to summarize this article, this is an article that investigated the microbiome competition in individuals with and without rosacea, and to correlate findings with individual environmental factors that can affect the microbiome on facial skin and in the fecal microbiome in stool. And that's what was the focus of this particular article. There were 84 patients with rosacea, 44 without rosacea. They were 18 years of age. The mean age in the rosacea group was 50, and about 70% of them were female. And the controls are about 98% female. These are the patients without rosacea. And they tended to have higher Fitzpatrick skin types, the ones that didn't have rosacea. What was interesting were the findings that they pointed out were that amongst the 84 rosacea patients, more of them were likely to have pets. Now, that doesn't mean that you have to go out and shoot Fido if your significant other has rosacea. In fact, in my house, I'd probably get kicked out before our dog Bentley, the little Yorkie that my wife loves. But I don't know how significant this is, but 72.4% of them had pets versus in the non-rosacea group, 52.1% had pets. The rosacea individuals were more likely to consume more alcohol, 2.42 drinks per week as compared to 0.78 drinks per week, or less than one drink per week. There was no difference in the use of skincare products. Specifically, you would think moisturizers and sunscreens, their use was about the same. Interestingly, they did swabs from facial skin and they tested stool and they looked at the microbiome. The abundance of bacteria was similar in both groups from the skin on the face and from stool samples. But what was different was there was more richness in the facial microbiome and more evenness in the patients that had rosacea. What does that mean? Richness has to do with diversity of organisms. So there was a greater diversity of organisms. And the evenness has to do with the relative number of the quantity of organisms. So the diversity of organisms was greater in the patients that had microbiome evaluated on rosacea. And there was a 3 to 4-fold decrease in the abundance of 8 distinct skin bacterial genera, right? So there were 8 bacteria that were noted to be decreased to significant degree in the patients that had rosacea. And these included Corynebacterium, they included Streptococci, and they included several other organisms. There were 8 of them. So the diversity was different on the facial microbiome. There wasn't a major difference in the fecal microbiome. There was some difference in some of the organisms that were present. So I think the bottom line here is that we know that there can be differences in the microbiome that correlate with clinical disease. And we've recognized in the past with some organisms with rosacea, not that it's an infection, but that these changes in the microbiome promote inflammation. And this is another study that lends to that. Whether or not some of these other characteristics regarding the amount of alcohol intake, which was different, but not dramatically so, or whether or not you have a pet, I don't know how significant that is, but there are going to be other studies that are going to look at some of these environmental factors. So this is a great first step.